Medical authorities in South Africa are on high alert following reports of the first cholera-linked death in the country in more than 10 years. South Africa has so far recorded 5 cases. The initial 2 were imported by travelers to Malawi, a country experiencing its deadliest outbreaks in 2 decades. But more concerning are 2 cases from localized infections. CGTN's Julie Shire reports.
Cholera is not endemic to South Africa, but reports of the first death in over 10 years by community transmission has raised alarm bells as the number of cases grow.
We thought it would not spread any further after the first 3 cases. Now, what we've just got the report now is the 2 confirmed cases with 1 who have already passed away. And these ones have got no travel history, unlike the first 3.
Cholera is an acute enteric infection which causes severe diarrhea. The disease spreads through contaminated water or food or close contact with an ill patient.
Whenever you have a setting with poor sanitation, with no or limited access to safe treated water, where there is poor hygiene and poor food safety practice, those are conditions that are ripe for a cholera outbreak and for rapid transmission of infection within a community.
Left too late, the disease can be fatal. Health authorities are hoping to avoid a repeat of South Africa's last outbreak between 2008 and 2009, which was also the worst. Over 12,000 cases were reported and 65 people died.
We have to be a lot more vigilant in terms of surveillance, in terms of also together with especially the water Department of Water and Sanitation to look at the areas where the 2 new patients have been diagnosed.
The rest of the continent, meanwhile, is fighting an exponential rise in cholera cases with hundreds of deaths in January alone. A limited amount of available vaccines are being stretched across the worst affected regions.
Most of the stock at present is being utilized on the African continent because at the moment the largest outbreaks are occurring in African countries. So, for example, Malawi has had a massive vaccine drive and they've used almost 5 million doses.
Conflict and extreme climatic conditions are behind worsening triggers of cholera. The World Health Organization has urged countries to beef up efforts to quickly detect and treat cases. It's also providing support to affected states to bolster key control measures to curb the outbreaks. Julie Shire, CGTN, South Africa.